Vein disease affects thousands of Americans, and it's more than just a cosmetic problem. Here with the details from the Vein Institute of Connecticut is Dr. Alex Afshar. Nice to have you back here, Doctor.
Thank you for having me.
For our viewers, explain what vein disease is.
Vein disease is a chronic disease that's got to do with backflow of blood through your leg veins. Blood in your veins has to travel up towards your heart, which means it has to depend on these one-way valves to prevent it from leaking back down towards the gravity. When those valves become incompetent, that's vein disease.
It doesn't really leave a pretty result, because you could see this on your legs.
Right.
So we're talking spider veins and that type of thing?
We are talking varicose veins, those greenish, bluish veins we call reticular veins, spider veins, so forth and so on, yeah.
So how do we treat this? There are a lot of different options.
There are, but nowadays this can be treated in a very short period of time as an outpatient under local anesthesia, and you're back to work right off the table.
That's incredible. So it's more than just a cosmetic issue. That's what we said in the beginning here. People start feeling heavy legs, or what are the complaints that you hear?
The most common complaints are leg pain, heavy tired legs, cramping, throbbing, restless leg syndrome is a big one, and swelling, which a lot of people get. So if your legs get tired at the end of the day, that's not just because you've been standing and you've been working hard. It could be an underlying condition that can be fixed and you get relief.
So if you don't fix this, what can happen? Can it get worse?
It's a chronic condition, so all chronic conditions, just like diabetes, hypertension, continue to progress and get worse. So many years down the road, you could get more swelling to the point where you can't put your shoes on. It can predispose you to blood clots if it's severe, and ankle ulcers.
Talk to me a little bit about recovery time, if that's even a thing.
With vein disease, there is no recovery time, and the reason for that is we want your blood to continue to flow. We don't want you to stand still. Anytime you manipulate veins, there is a chance, a slim chance of a clot. So we want you to get off the table, go for a walk, go to your back to your normal activities. So there is, pretty much zero downtime.
Sure. Talk to me about locations, because you're all over the state now. The Vein Institute of Connecticut is everywhere. You keep opening offices, and you make it really convenient for patients.
Yes, we do. It's because, medical offices have to be convenient. They have to be within driving distance, where people can do it between, in a work day, but during their lunch hour. So now we currently have a location in Avon, which is opening in middle of February. Shelton is already open. Newtown has been around for many years. Fairfield and Westport are also open to serve patients.
All over Connecticut. You certainly do make it easy. And just call, make an appointment, check out your website. With no recovery time, there's no excuses, right?
And covered by insurance.
Oh, it's spectacular. Doctor, thank you so much for being here.
Thank you for having me.
And of course, you can learn more at veininstitutect.com.